morning, sir. Myself, Dr. Jagdish, a pediatrician at Tiruvannamalai College, looking after District Early Entrance Center. Okay, sir. Looking after DEC at Tiruvannamalai College. I know sir, Professor Gunasingh sir from my CRI days 98 lende. I met sir at Ahmedabad conference. He said, "Enappa இப்படி தொப்பை வச்சிருக்கேன்னா எதை பண்றியா இல்லையா அப்படின்னாரு. சார் கண்டிப்பா will start sir அப்படின்னா. So on the day I started exactly February 2023. Now almost 8 months over, and I lost about 8 kg from 80 to 72 now. So I thank our professor for this. Moreover, pathina, not only weight, had a severe reflex also, GRD. That I don't have any symptoms now. The sleep was very good. And morning I do some exercise also, 1 hour exercise, 6 to 7, half an hour walking and half an hour stretching exercise for core muscle strengthening. So we have a special team. We are about 10 doctors representing the whole team. I'm coming here. Plus my wife also started. She also lost some 10 to 12 kgs also. And then planning my daughter and the son also to include in this, but it's very difficult for them to motivate them. Really, thank you, sir.
Most important thing is people think the gastric problem get worsened, but in fact it becoming better. I was using nearly for 30 years I was taking omeprazole. After starting intermittent fasting, it's gone. Now for the past 1 year, 2 months, so I'm not at all taking any medicine at all. So it cures so many illnesses. If everyone in India started intermittent fasting, so many pharma company has to be closed. I think it may have a lot of impact on economy. I don't know. It may be true. I request our President, Dr. Tamilmani, also to say something about his experience, because he is an inspiration for me.
Good morning, friends. I'm very happy to be here among you to share a few words. We have started exactly in August 2022, almost 12 months. And it has changed my lifestyle entirely. I have lost around 20 kilos. I was around 98. Now I'm around 78. And the activity, like our usual, in and out, we have to deal with our patients. And it gives me a lot of patience to deal with patients. And before I used to get a lot of anger and things like that. Now I am calmed down so much. So it not only it gives physical, it also mental happiness it brings. It's really a wonderful boon. So, and not only that, growth hormone levels, things like that seems to be becoming better. And all your hormonal tablets and all you can reduce, or you can even stop if you have any deficiencies. Even I have reduced my diabetic drugs by half. I think maybe another 5 kilos or more. If I lose, I think I can stop even that. And it's really a reversal of diabetes also is a part of this. So it's a really nice method. I wish everybody to get advantage of this program. It's really a wonderful one. And it is not at all difficult. It takes few days for us to habituate, that's all. So once again, I thank you very much.
This is to show it is not just intermittent fasting gives you health. You need to do some exercise also. So every day I do yoga for at least 1 hour. It's free in our hospital. Every day, yoga master comes there and teaches at 6 to 7. So today I'm going to tell about maybe in another half an hour, just an introduction which will stimulate you to follow intermittent fasting, some of the difficulties. See, almost 60 lakhs people are dying of NCDs like hypertension, diabetes, cancer, and other things. Of this, 25 lakhs people are dying of cardiovascular diseases. Right now, I am in Tiruvannamalai as a dean in Arunai Medical College. I see every day so many people are dying. And within 6 months, our hospital has, finished around 1,000 angiola. It's a small rural medical college. Even people from rural area, it is not limited to some obese people also. So I used to wonder, even the other day I bought on mobile phone, I bought one pouch. For that pouch also they give a user manual. I don't know what is it. They have a QR code to how to use that pouch. But do we have a user manual for us? I don't know whether I should. He may be eating something. I am eating every day 4 eggs and some fruits. Some afternoon also eat some. For the past 1 week, I'm taking some fish only. I feel that is the best thing. You may be taking something else. I should cycle every day for 1 hour. Otherwise, I thought I will die. There are crores of people not doing, even not walking also. They may be healthy. I don't know. We should have some user manual. Probably the intermittent fasting is the best way you can use it for our body. Because I am sure everyone, even in a small family, everyone's lifestyle is entirely different. Somebody do severe exercise, somebody is eating nicely, still they are happy. Okay. So how a pediatrician turned to promoting intermittent fasting? I think it is in 21 August last year, I invited Dr. S. Balasubramanian. I think he is Dr. S. Balasubramanian. He was the former retired director of KKCTH and my friend for many years. So I invited him for the talk on flu vaccine. But we have only 10 pediatricians there as a IAP member. I want to collect some more people. So along with IMA, I want to give a talk on secret of weight loss. So many people registered actually, 40, 50 people. Then initially I gave the topic. Then I started, preparing for the talk. Then I heard a lot of evidence for intermittent fasting for weight loss. I learned about ketogenic diet. I learned about paleo diet. I learned about Atkins diet. So many diets are there for weight loss. So I gave the talk. Actually, Dr. SBS, after returning to Chennai, called me and said, Gunasingh, that is a wonderful talk. And I am going to follow intermittent fasting. He is now following the intermittent fasting. So before going to give a talk, I thought, why not I follow? So I just, before 1 week, I started with 16, 18. Then 16, 18 means I have to finish off my lunch, everything by 4 o'clock. But 4 o'clock, what to eat? So then I took 18-16. I mean, 18 hours fasting and 6 hours feasting. From that day onwards, I am doing 18 hours fasting and 6 hours feasting. So then I didn't feel, not for a weight loss. Basically, that time I was 68 kilos. I'm happy. I do all the exercise. Then one day, when I was going with my friend, Dr. Tamilmani, sir, why not you follow intermittent fasting? That time it was so heavy. Sir, vidunga sir, avarum paathukalam ellam mudiyadhu. Then after few weeks, I saw him reduce his weight. Then, sir, now follow pandren. Night, evening by 6 o'clock, I am finishing. I am taking chapati la edutittu poiren. Okay. So what is intermittent fasting? Why it is popular? Most popular weight loss method. If you go into the Google and search, there are millions of YouTube, millions of articles. Even Cochrane review says this is the best method, evidence-based method for weight loss. Like not only weight loss, but also control of diabetes, hypertension, increased longevity, improved cognitive function. It's a method of, there are, I think Dr. SBS is going to tell about various methods of intermittent fasting. I'm not going to that. So it's just like that. In Patti, it is going to tell what you have to, it is not going to tell what you have to eat. You eat anything. When to eat, what period, it's a time restricted time you have to eat. You may be eating 3 times, or you may be eating 2 times, or you may be eating 1 time also. Paleo diet, ketogenic diet was very popular in Western. Even now they eat only mainly 75% fat and another 25% protein, then very limited amount of carbohydrate. Both are low carb diet, paleo and ketogenic. I think when I was in SRM, I had a severe joint pain. So I thought, I was shopping doctors. Oh, they were all giving drugs. Then one morning I thought I should reduce my weight. So I tried many different methods. I couldn't. Then I tried paleo diet. Within 2-3 months, I lost some 5-6 kilos. I think Dr. Kamalakandan is there. He knows. We used to, in spite of I'm physically active, I had a joint pain. I used to go for 4 o'clock. I used to go for swimming. 4 to 5. Still, I had a joint pain. So that time, then because of paleo diet, I lost weight and the joint pain became all right. Okay, so I was actually following for nearly a year or 1.5 years also, but it is very difficult to follow. I think once we went to Himachal Pradesh, we couldn't get anything, paleo diet, all vegetarian. I find it difficult. Because in intermittent fasting, you can eat anything, only in the time restricted period. Even the Jason Funk says you can relax when you go for vacation. But I think myself and Dr. Tamilmani, we went for Thailand trip. We were very happy. All people were eating like anything in night time. But this fellow only during night time, they taken to a nice restaurant. But no problem. We had a nice walk in Thailand and Pattaya. So all these diets are difficult to follow for a long time. Maybe 1 year, 2 years. Then once you stop all this diet, you will regain the weight. But this is an intermittent, it's a lifestyle change. That's all. Whether I can stop one day? No, it is a lifestyle change. I'm sure till my death I will follow intermittent fasting. But the life, death will come little later. Okay, because longevity, it will increase. I hope so. One of the thing is the craving is reduced. Other diet, you will have some sort of craving. Here, the craving, because now actually yesterday afternoon, 2 o'clock, I took food, yet to take food. Nearly 19 hours. Now the ketosis occurs. So this metabolic switch, usually for you people, the glucose is the main fuel. After a few hours, 12 hours or 16 hours, the ketosis occurs. So that one will reduce the craving. It reduces the craving. You will have a normal appetite. I will have, just after this talk, I am going to have my breakfast. Consists of hunger cues and satiety cues. You will have a mindful eating. I have seen many people saying like that, sir. Sir, I can manage the enna saapnonu theriyum. So this is our friend, nearly 98 kilos about 1 year back. This is taken after 3 months. At that time itself, he was reduced nearly 10 kilos. So he's about maybe 10 years back. I was weighing around 75 kilos. He had in Savera Hotel where he came. It's also about 10 years, 14 years back. See, Kushbu Sinna Punna Rukai, I am very big. Okay. So this is recently I took with Talaivar, no? Is okay. To show, okay, I thought I am becoming younger, no? Okay. So suddenly, one day I have started on group. I think last time where we went at that Goa trip, we started a group called Intermittent Fasting for Weight Loss Group. So adula or naal thidirnu in the message varudhu, sir started OMAD 1 meal a day since this year 14 kilos. Suddenly or message varudhu. He is none other than his today's speaker, Dr. Appanraj. He is a professor of medicine in Melmaruthur Medical College. It is how it's tremendous, no? Yeah, 2 days back I went to a marriage. One famous surgeon, super specialty. Number 1 in India, number 1 in national. Okay. I met him, he's thin. Sir, enna sir aachu? Gunasingh, ungala maada intermittent fasting. Edukku sir neenga? Illa sir, mother had cancer, died of cancer. So I am trying to prevent cancer. Okay, then another reason. If I have a lot of my sister died, another sister is having cancer. I think we all, our family members I should do fasting to prevent cancer. அவங்க ஒய்ஃப்ட கேட்டேன், என்ன சார் இப்படி இருக்காரு அப்படின்னு. ஆமா குணசிங் இப்படித்தான் இருக்கிறாரு. ஓகே. So this is a drastic 108 kilo, but he regained weight recently during marriage. I saw probably bariatric surgery that time done. Bariatric surgery is not a cure. Many people regain weight. I think Dr. Kamalakandan knows that our Venugopal wife and daughter undergone bariatric. They regained weight 40-50 kilos. Without lifestyle change, if you do any treatment, it will be a failure. Many people think if you go to a gym, you will lose weight. How many people think by going and doing exercise you can lose weight? Many people think. And class students you cannot lose weight anything. Okay. Exercise is like brushing your teeth. It is good for you, should be done every day. Just don't expect it to lose weight. I do morning 14 kilometer cycling, 1 hour yoga. Then at end of the day, I see my watch. It is only 150 calories only I lost. 2 இட்லி 3 இட்லி சாப்பிட்றது தான். அப்போ நம்ம இங்க இருந்து டெய்லி திருவண்ணாமலைக்கு சைக்கிள்ல போகணும்னு நினைக்கிறோம். whatever I eat. அப்பதான் போகும். Otherwise you don't expect you to lose weight by doing exercise. Okay, it's all cheating. Herbalife, within 3 months, 30 kilos you lose all. So this one, it's a needy Venba. The other day I was talking to one dean. He was telling this, Orubodu yogiye onthalirkai made, irubodu yogiye, bogiye enna, tiribodu rogiye, நான்கு போது உண்பான் உடல் விட்டு போகிய என்று புகழ். தளிர் போன்ற கையை உடையவளே, ஒரு நாளைக்கு ஒருவேளை உண்பவன் யோகி, இருவேளை உண்பவன் போகி, 3 வேளைக்கு உண்பவன் ரோகி, நோய் உண்டாக்கும். 4 வேளை உண்பவன் விடல் விட்டு போகி சாவு. அதாவது 4 வேளை உணவுன்னா சோறு போடுறதுதான் இல்ல. இப்போ டீ குடிக்க போறோம், அதுவும் உணவு தான். Sometimes your tiffin become more than a meal. Okay, so yogi, bogi, துரோகி 4 வேளை சாப்பிடுறோம். நம்ம தான் 6 வேளை 8 வேளை நைட் எல்லாம் சாப்பிடுறோமே. ஐயோ, okay. Only mammals in the world who eat even when they are not hungry is human. Even our pet animals become like that. No other mammal will eat like that. No. Mani என்னைக்காவது வயல்ல இந்த மாதிரி காஃபி they get together. Nothing. We are going against maybe nature. Who found out morning breakfast and lunch and dinner? It's necessary. God only knows. It's not necessary. If you are not hungry, why do you want to eat? By reflex, okay, 12 o'clock vandachi poi saapidum avladhaan. You can continuously eat. If I give, even now, if I give some sweet, you will eat. And after 1 hour, you will eat. Okay. It is not for survival. It is a pleasure eating. Psychologically, you are tuned up. Recently, about 2 to 3 years back, in Thai caves, 13 children held up in a cave. They all flooded. So 9 days they went without food. Nothing happened to them. And one More, or somebody is co-author of one book, he says he is doing 1 month fasting and all. I don't know how it is possible, but he has done, what is it, sugar, everything he has written in the book. I will show. So calorie restricted diet and the intermittent fasting, these are the difference. If you restrict calorie, your craving will increase. If you do intermittent fasting, your craving will go down. Your insulin level will go down and your belly fat will go away. I have seen in intermittent fasting along with exercise, my weight size was previously 34 to 36. Now it is 28. Within a year, the belly fat is almost gone. 8 inch. Is it possible? I think 15 centimeter maybe. Okay, uses ketone as fuel is glycogen. Okay. Just intermittent fasting is tell you when to eat, not about what to eat. நீ என்ன வேணாலும் சாப்பிட்டுக்கன்னு சொல்லுவோம், பட் அப்புறம் வந்து கொஞ்சம் கொஞ்சம் இப்படிலாம் கொஞ்சம் ரெஸ்ட்ரிக்ஷன் போடும். பட் இனிஷியலி யூ கேன் டேக் 3 time meals ஆல்சோ. இட்ஸ் நாட் அ ப்ராப்ளம். So mechanism of weight loss. So whatever we eat, go here and it is absorbed. Okay. The glucose is utilized by the muscle and other organs. Excess calories stored as a fat in your belly. Okay. This is a mechanism. Whatever you it will. This is a mechanism. Okay. When we were living in caves and other thing, you need lot of calories. You will not have any food for another 3 days or 4 days. So you need lot of calories. So you will eat nicely, then store everything. But now, even continuously also you can eat. The food is available everywhere. Even if you order now in Zomato, it will come in another 15 minutes. Now they are going to bring one more app. That fellow will come and feed you also. வாயில கூட ஊட்டி விடுறதுக்கு ஒருத்தன் வரப்போறான். ஏன்னா இட் இஸ் வெரி டிஃபிகல்ட். இவ்வளவு கஷ்டப்பட்டு சாப்பிடணும். இவ்வளவு கஷ்டமா தானே இருக்கு. So when you fast, okay, this lipid storage is mobilized. When you eating, you are getting your glucose is stored as glycogen and the calories is stored as fat. Okay. So whatever calories, ni carbohydrates sour சாப்பிட்டாலும் it will stored as fat only. So it was if you eat only fat, you will become fat is a wrong idea. Okay. So when you are doing fast, the mobilization occurs, body weight loss comes down, glucose comes down, insulin resistance comes down, all those effects occur. So by 12 hours, 12 to your glycogen will go away, liver, and your fat will start utilizing for energy. Okay. So as the time goes on, by even 24 hours, if you do fasting, autophagy started. That is the important thing to reduce your, increase your longevity. So up to 2 days, they say it is fasting. After 3-4 days, it is starvation. But people are doing. So இதெல்லாம் அந்த calorie restriction பண்ணும்போது initially you lose weight, then you regain weight. Okay. Actually, when you restrict only calories, the hunger increases. So you try to eat. ஒரு 4 நாள் நல்லா இருப்பாங்க, 5ஆம் நாள் போட்டு அடிச்சு செம்மையா அடிச்சிருவாங்க. அவ்வளவுதான். 5 நாள், ஒரு வாரம். அதுக்கப்புறம் கடக்க முடியும். இட் இஸ் ஹார்மோனல். யூ கான்ட் பிளேம் சம்படி நீ நல்லா சாப்பிட்ட அப்படின்றது. யூ கனாட். அதர்வைஸ் எல்லாருமே சாப்பிடாம இருந்து செத்து போயிடுவாங்க. So it is not that if you fast, your hunger will increase. It comes in waves. Okay, கொஞ்சம் ஏறும், அப்படி நம்ம பார்த்துருக்கோம். ஒரு 2 மணிக்கு சாப்பிடல, பசியே போயிடுச்சுன்னு யூஸ்வலி we tell அந்த டைம் வரலன்னு. So like that, ghrelin will not go high, no, it will go. The ghrelin hunger hormones. So in intermittent fasting, your hunger will reduce. So this is the one. Okay. So initially when you eat, the glucose will go up, then comes down. So after 12 hours of fasting, your ketone bodies will start rising. So initially when the glucose, when you eat, the insulin level will go up. Then it comes down. Okay, or 12 hours from. Then other hormones, cortisol, glucagon, epinephrine, the hormones, the counter-regulatory hormones will go up. So that will keep your glucose level normal. So your carbohydrate, sweet, everything will keep the insulin up. Protein also little, okay, little high in the insulin, and fat is very minimal. So that's why they say if you eat bulletproof coffee, to keep the insulin low. So this is Jason Fung. He's a nephrologist. He has written lot of books and videos. You can watch videos about intermittent fasting by him. So use intermittent fast to lose weight and live longer. Okay. So before 1960, people were lean only in America. This one. Then around 60, 70, they gave some dietary guidelines. They say low-fat diet will prevent heart attack. People are dying of heart attack in US. So they said no fat. Fat is killing. Cholesterol is killing. And they advised low cholesterol and high carbohydrate. That led to severe obesity in nearly 70 to 80% of Americans are obese or overweight now. Wrong guidelines by the Americans, American Heart Association. So if you calorie restricted diet, you are very difficult to lose weight because your BMR will come down. Basic metabolic rate, your utilization of energy will come down, so your weight will stationary. But in intermittent fasting, you will lose weight. Same 2000 calories you take, same fellow taking intermittent fasting with intermittent fasting, this fellow will lose weight, that fellow will gain weight. But it is very difficult to automatically your calorie intake will come down intermittent fasting because the window is very narrow. Okay. Hunger decreases, metabolism stable, weight loss maintained. Hunger increases, metabolism decreases, BMR will come down and you regain weight. So there are a lot of benefits of weight loss. Pseudotumor cerebri resolved. There are so many things. Okay. Mortality reduction is 30 to 40% and quality improvement is 95%. My blood pressure was 120/80, now 90/60 or something. Heart rate is now 48 now. எல்லாரும் 70 இருக்கும் நார்மலா, அப்படியே குறைஞ்சி become 48. So there are the gut health, they say, reduces the reflex and improves sleep. I was sleeping only for 4 hours before that. Now I am sleeping 6 hours. Excellent quality of sleep. People think, ஐயோ வெறும் வயித்துல இருந்தா எப்படி தூக்கமே வராதுனே. That is wrong. I used to think, நல்லா வயிறு முட்டை சாப்பிடணும். நம்ம ஊர்ல அப்படிதான், நல்லா சாப்பிடுன்னா அம்மா சொல்லி கொடுப்பாங்க. நல்லா சாப்பிடு அப்படி. Okay. So one of the important benefit is autophagy. This is Oshumi in 2006. He found out the autophagy. Autophagy occurs in everywhere. Even exercise will induce autophagy. Okay, this intermittent fasting will shut down that mTOR pathway and stimulate autophagy. This is like a service center for our car. It will remove all old cell and generate new cells, all those things. So this is how this autophagy is helping us to reduce the incidence of cancer, reduce aging, all those benefit. So now you want to start intermittent fasting, what should I do? You can do some cholesterol, basic fasting, sugar, HbA1c, and thyroid, all other things like insulin, basic, fasting insulin also you have to take, and check your waist circumference and BMI. Your waist circumference will definitely come down with intermittent fasting, even before your weight comes down. You should have some motivation, reason for losing weight. Set an achievable goal. Okay, 1 month I should lose weight for 3 kilo. Maybe 3 months, 10 kilo, something. Support group. One of the important thing is don't go and get an opinion about intermittent fasting. Your doctor who is not practicing, they will discourage you. I have started one support group. You can join this group also. It will be slow and steady. You will enjoy the benefit of intermittent fasting. You will be very active actually. The upper ilia crest la dhaan edukano, the waist circumference. Okay, the various types of intermittent fasting Dr. SBS will tell. This is simple one, circadian rhythm intermittent fasting, 12 hours only. Sunset to sunrise you fast. So normal. Everyone can do it. Even people used to do it. Nowadays, even now the government approved, even throughout night the canteens are open. Most horrible thing. Okay, this is Jason on Fonda. If you watch that man Fonda, it's an Indian, like, he is talking about intermittent circadian rhythm fasting. Get sunlight exposure during the day. Plan meet predictable time. Okay, eat 7 a.m. to 7 p.m. You can start with that. Then slowly go 14 hours, 16 hours, 18 hours. Keep lights also low at night. That's what the circadian rhythm says. Drink only water and avoid eating. Only water. That's a clean fasting. Konjound palan saaptukalama. The Jagadish was doing like that. He was not losing weight, and then I found out, sir, night palam mattum sir saapidren. Vachi palamum paalum pot. Then he stopped that, he started losing weight. So eat 3 meals, 2 snacks a day. Okay? And then 3 meals, you cut down snacks, then 3 meals in 12 hours. This is circadian rhythm fasting. Then eat 3 meals in 8 hours. 16 is to 8. 16 hours fasting. 8 hours la ungala mudinja alavu saaptu parunga. It is very difficult. Then eat 2 meals 8 hours. I'm doing this. But I'm 18 into 6. But 6 to 16 is to 8 is good. Okay. So slowly you can come down. You can't suddenly overnight. If possible, you can do that. Okay. See, advantages, cost is 0. For the 1 year, I was stopped eating the night. I forgot what is dinner also. I don't get anything. So probably ஒரு நாளைக்கு 200 ரூபாய் போட்டாலுமே இன்னைக்கு எவ்வளவு சார் ஆகுதும்? 6000, ஒரு 60000, 70000 ஆகுது. ஒரு ஃபேமிலியில 10 பேர் சேவ் பண்ணாங்கன்னா 6 லட்சம் சேவ் பண்ணலாம். வேஸ்ட் தானே, we are wasting. Okay. No food craving, normal food, no deficiency. You take vegetables, everything, nuts, everything. You need to concentrate on protein, 60 grams irukano. Okay. So pregnancy, breastfeeding mother less than 18 years avoid. Type 1 diabetes you should avoid, because weight is below normal also you can avoid. No? Then I also, I'm 18.5. If it goes below, you take ஒரு நாளைக்கு கூட சாப்பிட்டா சரியாயிடும். Type 2 diabetes, Dr. Appanraj is going to talk about diabetes. We can, Dr. Tamilmani is a diabetic, is reduced. Now you stopped, sir. இப்போ முன்னாடி 1-2 சாப்பிட்டுட்டு இருந்தாரு. He has stopped. I mean, come to off tablet. So how do I know intermittent fasting is working? After few weeks, you will reduce craving. You can manage hunger nicely. Sleep better, more energetic, weight size will come down, weight loss may take time. But people think intermittent fasting பண்ணிட்டு அடுத்த நாளே போன உடனே இப்படி சொல்றன்னு வரும்னு நினைக்கிறாங்க. It cannot happen. They find some lot of difficulties initial days. Okay. So reality, you want to explain, it will happen like that. Okay. So when plateau occurs, there is a lot of problem. Sarukum ipo 1 year kittathara 6 months 80 la irukkaru. There are many people. So he is Dr. Prasanna will talk about that. So strictly no weight loss na, there is something wrong. Not following intermittent fast strictly, they think only meals. No, nothing. Clean fast means only water. Nothing else during fasting time. Overeating during eating window. 18 மணி நேரம் 16 மணி நேரம் முடிச்ச உடனே அப்பா போட்டு அடின்னு அடிச்சா அவ்வளவுதான். இருக்கிற ஜங்க் ஃபுட்டு அதெல்லாம் அல்ட்ரா ப்ராசஸ் ஃபுட், ஜங்க் ஃபுட். Fasting period is not adequate. Suppose 12 hours you start, then increase it 14 hours, then 16 hours. It becomes very easy. That's what I am telling. It becomes very easy. Initially, sometimes you may find it difficult. Also, good sleep also important to have a nice, successful intermittent fasting. There are guidelines available. Okay. Another thing is you should definitely do some exercise. Even if you are not following intermittent fasting, also you do something. I have never seen people are walking. There are a lot of park available in Chennai. Nobody is. How many of in this crowd daily doing some walking? Please raise your hand. Oh, good. At least 75%. Very good. Anyway. Okay, there are when Prasad is a trainer, he is going to tell some exercise you need. So it is at the end of 18 hours fasting. So I do go for cycling. இது 7 மணிக்கு 8 மணிக்கு அந்த சமயத்துல. So it is good. You should do that. If you want to reduce your belly fat, intermittent fasting plus exercise you do, within 3 months your waist will come down. I am sure. So this is a neat non-exercise activity. Do actually keep you busy. Don't sit for a long time. So this is benefit of yoga. Okay. Daily at least 10 minutes you do some Surya Namaskar. அது 12x10 ஒரு 10 தடவை பண்ணீங்கன்னா 120 exercise வந்துடும். Never sit in a place for more than half an hour. Just get up. Just get up. Please come. You can do sir, Kapalabhati. இதான் பிராணாயமாவா? இதான் கபாலபதி தான் பிராணாயமா? அப்படியா? ஆமா, கபாலபதிங்கிறது யா அது ஒரு குருஜியே நம்மகிட்ட இருக்கிறாரு. அவரு நம்ம உண்மையிலே குருஜி தான். Okay, so I call all our first year students every day yoga. I also go. I am here now. So please concentrate spend some 10 minutes every day. Okay. AHA recommendations are there. How much, how much heart rate you should go. You go to AHA and exercise recommendation, it gives everything. So sitting is a disease. Never sit there for more than 20 minutes. Just get up for go and 5 minutes. So your Apple Watch will tell you it's time to stand. Okay, you can set, okay. So அந்த அதுக்கு ஒரு செட்டிங் வச்சிடலாம், 1 மணி நேரத்துக்கு நடக்கணும் அப்படிங்கிறது. So these are some guidelines. Never go to any parties, restaurant. So you try to overeat. If you are doing intermittent fasting, don't, initial period at least don't go to parties. You will be tempted to eat. Never eat processed food. Anything packed on, expired on, that's ultra processed food. It contains lot of preservative, lot of salt, sugar. Sugar is most addictive. சக்கரை இல்லைன்னா நீங்க டீ காபி குடிக்கவே முடியாது. Sugar is the most worst thing. Start looking into the label. You all, many of our people are doctors. Are you looking into the label, what it is contained? Most of the time, it is a empty calories. Sugar dar, no protein at all, no macronutrients. So avoid going to supermarket. They will, especially with your children. Never eat in front of the media reading. Eat only in the dining table. TV la paatittu அப்படியே eat like anything. 2 hours, 3 hours, especially with children and all. Nowadays, children becoming obese. Early to sleep, early to wake up. That is most important thing. I don't know how many pindungi munnaluvala. எத்தனை பேர் பின்தூங்கி முன்னெடுவாங்கன்னு தெரியல. Never force feed children. I tell them, நம்ம பிளேட்ல 6 மாசத்துல இப்ப சொல்றான், that is baby led weaning. You put everything food there, குழந்தைய சாப்பிடும். குழந்தைக்கு நடக்க சொல்லி கத்து கொடுக்கறது இல்ல, அது தன்னால் நடக்குது இல்லையா? பேச சொல்லி கத்து கொடுக்கறது இல்ல, அதுவே பேசுது. ஆனா சாப்பிட மட்டும் நம்ம சொல்லணும்னு நினைக்கிறோம். போட்டு அடிக்கிறாங்க, சாப்பிடலன்னா போட்டு சாத்து. அது என்னன்னா, ஒரு அம்மா வந்து சொல்லுது, சாப்பிடவே மாட்டேங்கிறான் சார். நான் எப்படி, நான் கைய காலை பிடிச்சுக்கோம். ஒரு தாத்தா ஒரு ஸ்பூனை விட்டு வாயை அப்படி திறப்பாராம், அது வழியா பாலை ஊத்துவாங்களே. என்னையா நடக்குது? இதுக்கு நம்ம இட்ஸ் பிளஷரபிள். எதுக்காக போறோம்? 5 கிலோமீட்டர் 10 கிலோமீட்டர் 50 கிலோமீட்டர் போய் ஒரு இடத்துல போய் நல்லா சிக்கன் சாப்பிட்டு வரோம். அதை போய் இப்படி போட்டு அடிச்சு உதைச்சா, ஆனா இங்க இப்படி இருப்பானா, பக்கத்து வீட்டுல போய் நல்லா சாப்பிடுவானா. அப்போ what is the problem? Problem is with these people. Okay. Avoid baked foods. Eat based on your hungry. Eat slowly. Harakachibu. If you take in a small plate, your food consumption will be reduced. It's a illusion. So eat less, move more, lose weight is not true. Fasting and feasting. Okay. Intermittent fasting is the ideal way to lose weight, but also to enjoy other advantages. If you want to eat normally, still want to lose weight without pain, follow, some mistake is there, follow intermittent fasting at 0 cost. Always combine intermittent fasting with exercise for best outcome. Please do some exercise. I hope everyone is doing that. So fat fasting, fat loss, appetite control, superior to calorie control, time restricted, insulin low and improve sleep, novel method. Growth hormone, human growth hormone is at the end of fasting, probably now it is 200 times more. So if I do exercise at the end of the fasting, your bulk of the muscle become more. There are some sportsmen, they are doing it. So this one, I think Dr. SB is also coming. I am going to invite some other people also. Weight loss made easy in Arunai Medical College. We have another workshop on December 2nd. Okay, the woods are lovely and dark and deep, but I have promises to keep and miles to go before I sleep. And miles to go before I sleep. I think I have many people. Selvi madam, I don't know whether she is. Oh, you are here. She said the other day, my wife told she's practicing surgeon. She's advising fasting in cancer treatment along with surgery. Okay, she said she's thrilled. So, sir, we should go to the beyond some limit. We should spread everywhere about the fasting. We should do that. Everyone should do that. It's a wonderful intervention. Okay. Together we achieve more. Thank you very much.